Well, hi, and welcome back to our ongoing series of Getting to Know Our Faculty. I'm Dr. Doug Evans, and I'm really lucky to be with Katie Iverson today. Katie, well, thank you so much for doing this. We had to snag you from the trauma bay or something today, but I'm glad we did.
Good, yeah, thank you for having me. Good to be here.
Katie's been with us now 2 years, right?
Just about 2 years.
2021?
In a couple more weeks, yeah.
Yeah, and maybe we could start with where you grew up and tell us a little bit about Katie Iverson.
Sure. So I grew up in Phoenix, Arizona, or Tempe, Arizona, for people who know the area. One of 3 siblings, and then my 2 parents there, and so had a good life there. Definitely a lot hotter, less snow, but getting used to the Midwest now.
Yeah. Now, I wasn't familiar with your college, so where did you go to college and why did you pick that school?
I went to Ursinus College, so it's a small liberal arts college outside of Philadelphia, and that I chose that college specifically because they had a good pre-medical program, but I still wanted a liberal arts education, and then I was able to design my own major in peace and justice studies, and then it allowed some other opportunities for kind of travel and exploration outside of the
So you knew
world.
you wanted to be a doctor back in Phoenix, Arizona?
Yeah, I had that thought, but then...
Yeah. Where did that come from?
It's hard to say. I think probably a lot of people had that thought initially, you think everyone wants to kind of be a doctor, but...
No one in your family in medicine?
No one in my family. Well, my mom was a nurse, and she did psych nurse for a while, but then she transitioned before I was born into social work and more building programs for homeless outreach in our area.
Oh, wow. So the idea of becoming a doctor actually came to fruition?
Yeah.
And med school was back to the West Coast, right?
Yeah, back at Oregon Health and Science University, so in Portland, Oregon.
How did you like living on the, well, basically you were in Arizona, so you were almost west anyway.
Yeah,
right?
Arizona, then Philadelphia, and then back to the West Coast. But it was good. I learned how to be a hipster, and how to live in coffee shops studying for school, so that was good.
Yeah, and how did you decide on surgery?
Yeah, it's a good question. I wanted to do primary care, which is also why I chose to go to OHSU in Portland.
Yeah.
But then I did surgery as my very first rotation, and because I wanted to just get it out of the way because I didn't want to do surgery. And my very first case was this open AAA repair, and I just thought it was the coolest thing I had ever seen. And then it was so nice to be able to be part of that surgery and then take care of that patient through their hospitalization, see them in clinic a couple weeks better. And they were back on their feet after having this huge surgery and a huge hospital stay. And so I thought that was just such a unique power to be able to really tangibly, affect someone and help get them better on their health journey.
Yeah. Oh, absolutely. I mean, I think there are so many people who are struck by that with respect to our specialty. It's really neat. So your residency then, after med school, and then you matched into surgery, and tell us about residency.
Yeah, so I went to UC Davis in Sacramento, so under Dr. Farmer and Dr. Galante, and then Salcedo as my program directors. So that was a really great place, especially kind of like here, it's a very big program, so about 11 residents per year. So it was nice to be able to rotate a bunch of different colleges or a bunch of different hospitals.
Sure.
Yeah.
And you did some research time, I think, in Boston, right?
Yeah.
How did you arrange that, and how'd you like living in Boston?
Yeah, so I was fortunate enough to get some good support from my college or from my residency to do a master's in global health at the Harvard School of Public Health. And then within that time, I did 2 years and worked with a program in global surgery and social change. So working on building surgical systems outside of the US. And specifically, I went to Peru and Ethiopia.
Oh, wow. Yeah, it would be good for those people who aren't in medicine who may be looking at your video and trying to get to know you. They may have seen you in the emergency room or the trauma bay or whatever. Tell us about, global surgery is such a hot topic right now. How did you get interested in it? And maybe even before that, what is global surgery?
Yeah. So global surgery in itself, I think, is more of an ideology in that everyone should have access to surgery when they need it, and no one should be essentially discriminated against based on either their location geographically or anything else. So how do we get people equal access to surgery when they need it is kind of the
Even
biggest
for
question.
common things like appendicitis
Exactly.
and car crashes and if they need their gallbladder out, right? Even cesarean section.
Yep,
All of that
exactly.
is, and the myriad of orthopedic injuries, right?
Yeah, and the anesthesia that goes with that. And
yeah, because there are places around the world where that just doesn't happen, I guess, right?
Or it's just really hard to access, so people will travel
Yeah.
miles and days to be able to access a hospital that has the care that they need. So.
Sure, and you've remained fairly passionate about global surgery here. So maybe a few thoughts on what you're doing in the realm of global surgery, and a little bit about MCW and the Division of Trauma and Acute Care Surgery.
Yeah, definitely. So definitely that was one of the reasons I was drawn here, is the great support from the faculty here for this and from Dr. Evans himself.
I do whatever Dr. DeMoya says.
Yeah. Exactly. So here I've been able to continue some work in Ethiopia. And so that's been really exciting to re-engage with my partners after COVID and after the war there, to figure out how we can continue our work to get more people access to emergency surgery and also building up their trauma capabilities. So I've been fortunate to work with Dr. Dodgen there as well, who also works on the trauma system development piece in Ethiopia.
Yeah. Really great.
Yeah.
Well, last, Katie, what do you like to do outside of work? We try not to give you too much time outside of work so that you don't get confused or don't overburden your car or anything like that. But if you do get a couple seconds outside of work, what do you like to do?
Yeah, so, I love the fluorescent lights of the hospital. I hate being outside, but no, I really like the summer and sunshine, and so that's been really great here in Milwaukee. Just had some friends visit, and we were able to try out sailing on the lake for the first time. We did some kayaking, some hiking, so I really like the warm weather outdoor sports, and, maybe I'll try some winter sports one of these days.
So yesterday, I think we hit a record at 100 degrees.
Yeah.
So that was like no big deal for you.
Yeah. It's like, why is everything shut down?
Exactly.
Yeah.
Well, Katie Iverson, thank you so much. Great to get to know you, and we're really thrilled that you made the decision to join our faculty.
Really happy to be here. Thanks for having me.